What's up, guys? This is Ryan Conley, and this is my week 2 post-operative FAI and hip labral repair. So I'm going to start off with some training today. This was the second time I was able to get into the gym and do some upper body training. I was looking forward to trying to be able to do some pull-ups. Unfortunately, that didn't work out. I had too much traction, I felt like, when I was hanging there from the bar. So I did some seated face pulls instead, lit the rear delts up. And then I was able to do some more dips. So I did 4 sets of 10, and then I did one last set to failure, trying to push myself a little bit, but not be, too uncomfortable or do anything stupid. But really just building some more capacity and then testing to see where I was at with that final set, which is what I've got videotaped here, going to failure. So I figured out I could do about 20 reps, and then that is what I will go based off of for the next workout, which we'll go over later. And then here we're doing some seated curls, just normal curls for 3 sets of 15 reps. This is only 25 pounds. It was actually super hard to do for me for some reason. I think I'm just still a little bit taxed from the surgery, obviously. So curls are a little bit harder than they should have been, and then 2 sets of hammer curls after that. Moving on, I did not do supersets with triceps and curls or biceps because I didn't feel like getting up. So I just did all this curl sitting there, and then I finished off with a long cluster set of tricep pushdowns. So I think I did like 40 or 50 reps here, and then this rested 20-30 seconds. The next set wound up doing somewhere around half that or a little bit more, so between 20 and 35 reps. And then the final set, I believe I got to like 15 reps. So cluster sets are really great ways to go to failure and get a lot of work in a short period of time, which is kind of what I was aiming to do here. I just wanted to get done, crank it out. So giving yourself that 10, 20, 30 second rest period between these sets is a viable strategy when you're in a hurry to get in and out of the gym like I was here. And then when you're handicapped, you can get to use a wheelchair, an electric wheelchair. So I figured I'd document this because this was the first time I ever got to ride around in a wheelchair in a commercial establishment. So thank you, Lowe's, for making my dreams come true. And then here we've got the recumbent bike. So I wasn't able to videotape that at the last PT session. So this was, I believe, my 4th PT session. So we were able to do a little bit more stuff, still restricted, still not weight bearing, but doing a lot more. And I've been able to progress, I would say, exponentially between every PT session. So here we're just doing some regular calf stretches, straight leg, and then bent leg to target the gastroc. So doing, I believe, 2 minutes total, so like a minute of each. And then we're going to move on here shortly to the internal rotation drills. So this is going to be called a stool rotation. And you're putting your knee on top of the stool and just pivoting on that stool there. So you're working your hip into internal rotation, which is what everyone's allowed to do after an FAI procedure. They do not want you going into external hip rotation, which would mean going the other way when we're standing. So this always lights my glutes up. Banded glute bridges with a 10-second hold. The band is there for also glute medius activation, so that's going to be lateral. And then we have awesome Bridget, who is a great physical therapist I've been able to work with at Select PT. She's cleaning up and making sure that everything's ready to go for the next client. Everybody that I've worked with at Select PT has been nothing short of awesome and very helpful in helping me return to becoming, capable again and independent. So I thank them for all their hard work and effort. So we did this for a little bit longer, and we're able to light my glutes on fire, and I think 20 reps of this was really making me scream towards the end. Then we have another internal hip rotation movement again, back to the log rolls. So this one's a little bit easier, but it's a straight leg movement. And I've had noticeable progression, which you can't really, it's hard to tell here, but I know the first session I was barely able to move my leg at all. So this is actually a pretty good improvement from where we started at like a little bit over a week ago. So I'm happy with that progress here, and I'm definitely happy overall with how the hip is feeling. There's only very few things that I'm doing lately that even pretend to bother it or tweak it at all. This is another great exercise. So this is going to be hip extension also for the glutes. You're just putting your leg on top of this med ball and then pushing into the medicine ball for 10 seconds. And like I said, we're doing 20 reps of this also. So this gets that glute working again, and is similar to like a gait pattern when you're walking. So this is an excellent exercise for PT and rehab to use. Then we've got here the hip adduction. So this is squeezing the medicine ball between your legs. Again, 20 reps with a 10-second hold. And the isometrics are just super, super friendly for any kind of physical therapy and rehab. And this is what you want to start off doing once you're recovering, or when you're recovering from a surgery or recovering from an injury, whatever. This is definitely step one, is using some kind of isometric exercise to bring that tissue capacity back up. It's very low risk and high reward. And then this was the post-op training session, upper body training session number 3. This one I was actually able to push pretty good for. So 5 sets, but I went up in reps on all these. So I went somewhere between 15 and 20 reps every set. And then I was actually able to do pull-ups. So I kept it at 5 sets of 5 here, supersetting with the dips. I felt stable enough with those 5 sets of 5 that I wasn't tractioning the leg too much. And it was, again, noticeably different from just trying to do it a week ago when I only did 2 reps when I tried it out. And I was like, I don't really feel like this is a good exercise to do for me yet. But yeah, dips dips have been, they felt awesome the entire time. Pull-ups did not feel good 1 week after, or a little bit after, a week after the surgery, but 2 weeks after the surgery, feeling a lot better and a lot more stable. So really able to get in and do some real almost bodybuilding and strength training again. So that feels really good. Still wearing the brace, still trying to make sure that I'm, respecting those range of motion limitations that are set on us post-operative procedure here. So they don't want you going into a ton of hip flexion and staying there, especially for, like long drives or long seated events. So I think this brace is intentionally made just to feel uncomfortable so that you don't want to sit there and wear it for too long or stay in that position. And then, yeah, we're just continuing to train here, breathing, working through some sweat and some heavy breathing. I would still say that I'm a little bit physically tired overall. In between sets, I'm definitely catching my breath and huffing and puffing a little bit, more so than I would say is usual for myself. But overall, again, just slow, steady progress and range of motion, and the ability to use the hip and leg and everything else is coming back very steadily. Again, going back to dumbbell curls today, this day I was not able to do as many reps, so I did 3 sets of 12 at the same weight, just because the pull-ups did fatigue my bicep and my arms more so than the previous 2 training sessions when I was able to just go straight to curls and knock those out. The face pulls weren't really giving me too much fatigue in the arms. So here we did tricep pushdowns again, 30 reps, 20 reps, and 15 reps. These were just normal straight sets. I didn't do any clusters on them. I actually went up in weight, I think, on the last 2 sets. So by the end of this, my triceps were smoked, and they had a really good pump. Same thing with the arms. I feel like I got a great workout in here today, and it was, it was a nice change to be able to get outside, or, get into the gym and get out here and sweat and do some hard work. So I've been basically splitting up PT and going twice a week, and then doing this every 3rd day, every 4th day or so. So getting inside, doing some upper body training 2 to 3 times a week, and doing PT for the lower body at least 2 times a week also. And that's it for week 2.